Everyone, and on behalf of CEED, I welcome you all for this particular discussion on role of DRE to strengthen the public health infrastructure in Jharkhand. Um, Before I get into the discussion, very briefly, I would like to talk about, as many people who are participating here might be aware about CEED. So, Center for Environment and Energy Development, in short, CEED, actually is an environment and energy expert group which works in Indo-Gangetic plain of, and we work on the issue of clean energy, clean air, waste management, and the water as well. Uh, Friends, before we get into this discussion, I would request all of you to be on the mute, and and if something is not clear, I would also suggest to basically type your feedback or concern in the chat box as well. That will really help us for us to understand and listen to each one. Uh, Thank you. Uh, Friends, as we all know that the COVID-19 has created really a very unprecedented crisis to the entire humanity. As of now, when we are speaking, uh, more than 5 million plus positive cases in the world, more than 350,000 deaths all over the world, and almost 7 billion people are actually living under lockdown. And it has created a lot of hardship and created a lot of unemployment and various other issues apart from the health. So there is an overall impact on the economy and the livelihood, general ritual like culture. Everyone is under lockdown, and we are facing a kind of a crisis which we have never had in the last 100 years. When you come down to India, even in India now, if you see in the last 10 days or so, the cases are going actually up, and it's really increasing very fast. As of today, we have almost like 145,000 positive cases in India and almost like 4,000 deaths already actually, which is basically we have surpassed China even in that way. Even if you come down to the Jharkhand, I mean, the Jharkhand situation, I mean, if you see the number, it looks quite okay. I mean, if you see it's only 400 cases and not much to talk on the deaths and all. But if you see the public health infrastructure in Jharkhand is really bad. Like if you see the ICMR data on the testing lab and all, Jharkhand has got only 20 test labs for the 3.5 million population. And with the reverse migration happening, there is a kind of a chance that more and more cases will come up, and it will come very fast. And that's why ICMR is also revising its dynamic testing strategy with more focus on the receiving state of the reverse migration. And we all are basically faced with a kind of a challenge in Jharkhand where the public health infrastructure is really not in a great shape. Keeping in mind the kind of population, the tribal population, the hilly and mountainous region, and the health services are not available to each and every citizen, say like in Jharkhand, and they have to make some extra effort to have that kind of health access. And on top of that, if you see, the energy has been playing a key role. And in many rural areas, what we have been hearing the story from the ground, that many of these public health infrastructure are impacted because of the irregular supply of electricity. Now, yes, I was talking to some of my journalist friends, and they were talking about like how the collected samples for the COVID-19 were destroyed by the time they reached to the testing labs, right? Because the testing labs now, since Jharkhand has 20 testing labs, and most of those labs are basically at the district level, and there are only three RT-PCR labs, which is in Ranchi, Jamshedpur, and Dhanbad. So it takes a lot of time to transport all these samples from the rural areas to the labs, and with the reverse migration happening, we do hope that there will be workers all over Jharkhand, and it is a big challenge for the state government to create a kind of a public health infrastructure where people can have easy access. And energy is one of the issue which plays a major role in order to create that kind of infrastructure in the remote areas, especially, and especially in the rural areas. So with this kind of situation, we thought to convene one small virtual discussion. In fact, this is the first virtual discussion for SEED. Um, so of course, we are also trying to learn like how do we basically create more and more discussion on this particular issue. So in order to take forward this discussion, we do have three eminent speakers with us who are going to talk about this issue. Dr. Suranjeen Prasad is a well-known public health expert in Jharkhand. He is one of the doctors who knows the Jharkhand health infrastructure completely, and he has been providing lot of support to the government of Jharkhand as well. And he's also associate director at John Hopkins University. So he has a complete understanding of the public health infrastructure in Jharkhand, and that will definitely give us a kind of understanding like how the health infrastructure are there, and in how and what kind of challenges and problem the health infrastructure in Jharkhand is facing, especially in terms of the electricity and the energy is concerned. Friends, we also have the Colonel Vijay Bhaskar. He is basically the country director with the MLINDA Foundation, and his foundation is directly involved in creating solutions on the ground. And thanks a lot, Colonel, to be here because your organization is doing something by creating solutions on the ground to promote the low carbon development pathway in the backward region and directly employing and giving livelihood opportunity to thousands of people in the rural areas in Jharkhand. And I'm pretty sure that your solution, especially on the mini, micro, and grids, to create livelihood opportunity as well as to power some of the most important infrastructure thing that we are talking about, like health, is one of very critical thing to happen. So we look forward to hear you as well. And then we also have the Pamli Dekka from the WRI. She is Associate Director Energy Program. And she is going to talk about how we can the DRE at a large level with the policy intervention or creating a kind of enabling framework where the DRE can power the public health infrastructure in Jharkhand in big way. So thanks a lot for all the speakers and the guests who are having who already have joined this discussion. I think we already have 24 people. I am expecting more to join in time to come. Anyway, so moving forward, I would like to come to Dr. Suranjeen Prasad. I would like to start with you to understand the public health infrastructure in Jharkhand and what kind of challenges that the public health infrastructure are facing, especially in the light of this COVID-19 crisis. And have you seen any kind of a situation, especially in the rural areas where the energy is becoming a kind of a bottleneck or a challenges for this health infrastructure where people can have easy and fast access to the health infrastructure? Dr. Suranjan.
Yeah, thank you so much for the introduction and for inviting me to be part of this panel. Before I start, I want to say that I worked in Jharkhand for the last 19 years, but in the last 5 months, actually, I've shifted to Guwahati. And so I missed out a little bit on the COVID-19 thing in Jharkhand, but, because I've been working there for the last 19 years, I've got a pretty decent understanding of, the infrastructure in Jharkhand, and also, have got some experience of trying to do some work around renewable energy, especially in the health department. So yes, I agree with what you shared about the COVID-19 epidemic and the fact that there definitely a lot can be done if energy requirements are provided, and we can see a lot of gaps there at this moment. if you are looking at the deep far out areas, what we actually have there is a lack of services at this moment because of the severe lockdown and the issues of the guidelines not going out. One of the most important activities happens in the field is what we call a village health and nutrition day, and what we call the routine immunization program. That was stopped in the first lockdown. Then in the second and third lockdown, it was asked to start again. But there's definitely been a whole disruption of service. So apart from the COVID-19 caused two problems. One problem is the disruption of the normal health services, and apart from actually taking care of the COVID-19 cases and the issues around that. So as you know, most of the COVID-19 activity, the major activity is happening in district headquarters, where everybody comes in to the front, and then these district headquarters have, say, a backup power supply and things like that. But what we actually are looking at when you're looking at the real power problem is in the deep rural areas of Jharkhand. So just the normal government data says that around 42% of PHCs are electrified. So just normal government data is saying 42%, which means 58% are not electrified. Now that itself is a big thing, and we all know that even those that 42 are electrified, we know that the truth of that electrification, the fact that though there is a power supply, but the power supply is not there, or the power supply is extremely intermittent, or there's something got cut because they didn't, some bills are not paid, or multiple other issues are there. And in fact, with Oxfam and with Telco Foundation, we were actually planning to do a large study to understand the real situation and the real energy requirement in these sub-centers and these PHCs. I saw the briefing note, and the briefing note does talk about the number of sub-centers, and there are a huge number of sub-centers. The present government is actually running a very interesting program to revitalize sub-centers. And as you are aware, this particular program has got the Niti Aayog, the government, and the district magistrates, deeply involved. It's called the health and wellness centers. And the health and wellness centers, one of the most important things in the health and wellness centers is electrification. So as JHPIEGO, my organization, we've been actually helping the state government to actually help in electrifying and help in getting all the things ready within these health and wellness centers to make it functional. And one of the most important criteria is electrification. As you are aware, electrification is just not only for lighting. It's also refrigeration. It's also for bore. And most of these places, most of these health and wellness centers are really built nicely, and they have a bore pump. And if there is no electricity, you ought to even get potable water, or running water is a very important criteria for a health and wellness, for any health center, because only with running water can you do hand washing, can you do many other medical procedures, and for that itself you need a good electricity backup supply. So we actually, there is actually Dr. Pathak, who is in charge of this within the health department, and so we've actually had 2-3 rounds of meetings with him and telling him, sir, we definitely know this is there, and we've been writing to all the district magistrates and the district collectors to look into this, but this is not happening. Can we think of something on the solar front? So he was saying, no, we talked to the secretary at that time. He said, no, it's mandatory that we have to have a real, line, from the grid, and we can't have a standalone solar electricity supply. But we said, at least that can be like a backup. And once you get your line to the grid, that's fine, and that would be great. But we also know that, what it, the quality of electricity that comes from the grid and the number of hours that it comes in. One thing, the state, actually our state, Jharkhand state, was actually a front runner at one time. Around 2004, 2005, then Mr. P.P. Sharma, a very dynamic personality, he was in charge of both health and later on in charge of, he was chief secretary too, took a massive project and actually installed solar vaccine, uh, you know, the, the vaccine refrigerants, and installed it in every place. And it was at that time considered something which was very innovative, very brave, and it used state government funding to do it. But unfortunately, that experiment fell badly. And what happened was that the state could not keep up and maintain those. And slowly they went into bad. Within 2 years, they were all disappeared or they didn't work at that time. So that was something, most of our health department people still have a memory of that. And especially then they also tried a lot of solar paneling at that time, which all got stolen. So though I know 2004, 6, 7, 8 are long time, and today we're talking about 2022, and there's a lot of difference between that and this. But that memory, which today's technocrats have still with them, was being a big determinant to convince them that we need to get into renewable energy. They, because at that time these people who are now at the helm of affairs were actually at the field level. They were in charge of the CHCs and the PHCs, and they actually saw this and they considered this a waste of effort. So that was one of the big challenges in advocating and in pushing the government to take this forward. These were some of my initial thoughts, that I've shared. Probably if you have some pointed questions to me, and if I'm not in the right direction of what you wanted to discuss, you could probably guide me to that. I just thought I'll just share some of my, thoughts that came to my mind right in the beginning. And thank you. Thanks a lot.
Thanks a lot, Dr. No, I think you are right on the point, and I think you have rightly pointed it out, like how the electricity has created a kind of infrastructure bottleneck for the health sector, especially in the Jharkhand. And I know that some of the initiative that taken in the past has not been maintained. And I also happened to discuss this issue with the PP Sharma, which you talked about. He had retired. In fact, he had taken the voluntary retirement from the government. So yeah, so there are a lot of issues. Of course, we will when we go into the discussion, we will have more pointers to talk about. So thanks a lot, Doctor, as of now. So I would like now to invite Dr. Colonel Vijay Bhaskar. I know, Colonel, you have been running a very wonderful program, especially in the backward region, in the tribal region. And I know that in the Gumla and all, and other parts of Jharkhand, you have been running these mini grid programs, and it's creating a lot of positive impact and bringing a lot of changes in the people's life. So can you talk about from your perspective as how this kind of solution can really help the state of Jharkhand to power its health infrastructure in a big way, not just say like in one pocket, but whether it can be translated into something, a big program for the state where all these community health center or public health center can be powered by renewable in some way. Because recently, when I was also talking to the Celco, and what I came to know, a very powerful solution like solar powered quarantine center, solar powered ventilators, a lot of things are there in the market, which I believe that government has to use it. So, Colonel, from your perspective, how do we can help actually the state of Jharkhand to basically, revamp its health infrastructure from the energy point of view? Colonel, you are mute. You are still mute. Yeah.
Sorry about that. Thank you, Ramapati, and very good morning to all of you. Yeah, Dr. Suranjeen Prasad spoke some very profound thoughts, and we are here on the ground getting things done. And I speak from the ground. I'm in Gumla at the moment. So a little bit about MLINDA for those of you who are not familiar with our organization. We work as a hybrid. So we have a not-for-profit and a for-profit working together. So the private limited company is the one which does the infrastructure part and the operations, maintenance, revenues, and so on. And the trust, the foundation part, they do the capacity building, the awareness building, financing, productive load machinery for livelihoods, and the like. Now, we started work in Jharkhand in 2014 based on a report which Pamli here gave us, saying that this part of India is very is low on electrification. And so we chose Gumla, Simdega, and East Singhbhum as three of the districts that started work in 2014. So we set up 113 of very small pico systems. They are about 500, less than 500 watts in size, and they would provide 6 hours electricity to 10 homes at a time. So this was a very popular program, and especially for off-grid hamlets, very small villages which were in the hills, very remote. This worked extremely well. But over a period of time, the villagers came back to us and said that, listen, it's fine. We are happy with the quality of life that has changed, and we are happy that we're able to charge our mobiles and getting electricity for education and things like that. But we would also like to have energy for productive uses, energy for livelihoods, energy to power health infrastructure, and the like. And therefore, we started an experiment in middle of 2015. We chose two off-grid villages, tribal villages, Naratoli and Shaitoli in Raidi. And then we set up these two small mini-grid systems. They were about 20.5 kilowatt each, providing 24/7 electricity, three-phase electricity that could power irrigation pumps, rice hulling machines, oil expellers, atta chakkis, and other livelihood loads. So, and then in conjunction with the village, we discussed with them and said what would be a tariff that would be workable for them, and also that would be workable for the solar mini grids to be commercially viable. So it was a kind of a two-way process. And as you're aware, solar systems are expensive, and a lot of it has to be initially grant funded for it to make at least portions of it to make it commercially viable. So these grids became an instant success, and by word of mouth, they started spreading. And today, we have about 40 villages in Gumla district which are powered by these DRE-based mini grids, all in the region of about 25 to 30 kilowatts each. Now, these mini grids provide irrigation services. They provide power for productive loads. They power livelihoods and run agri-processing machinery, besides powering domestic appliances and the like. Now, in as far as the health infrastructure is concerned, out of these 40 villages, there are 4 villages where the mini grids are powering primary health centers. There's a village called Fori, where there's a 10-bed hospital, which has a baby warmer. There's a refrigeration system for drugs and vaccines, and also there is a small operation, a minor operation theater. So this gets 24/7 electricity. Now, another village called Patia, where there's a primary health center which is fully powered by the mini grid. There are also villages like Kashira and Murkunda, very large villages, where private health clinics are being powered and pharmacies are being powered. Now, so this is 4 out of 45. So why is it that we're not able to go beyond this? There are some very systemic reasons for this. Firstly, there is already an allotment by the ministry concerned as far as electricity is concerned, and therefore the payment for electricity is not borne by the government, but is borne by the village itself or some interested parties who want to keep these centers running. So that is a major issue that is there. So going forward, how is it going to be? Now, if you look at the situation that is emerging at this point, that is the COVID-19 situation, in the third week of March, lockdown was imposed, and as Dr. Suranjeen Prasad just brought out, everything was very badly hit. The government then approached us at that point and said, "Can you guys keep keep your services running? And we are going to declare these services as essential." And I have about 120 staff which is working in these 40 villages, and so they were given passes. They were given provided with protection, safety protocols, and then the vehicles were given passes and were asked to keep these services running. But first, there's some very interesting observations that emerged from this. For the first about 10 days or so until the 1st of April, the villagers prioritized stocking food, medicines, and essential supplies over electricity, over energy. But come April, and today it's almost 2 months now, there's been a huge surge in the electricity consumption vis-a-vis what's normal. So if normally a village consumes around 50 to 60 units per day, now the consumption has gone up by almost about 10-15%. It's possibly can be attributable to the fact that they are all remaining in their homes, so a little bit of entertainment on television and things like that. But also the fact that it's dry season now, and all these the vegetables that grow in the dry season, like pumpkin and watermelons and gourds, these have become top priority, and the government has ensured that the supply chain for these vegetables has been maintained. So though initially there were some hiccups, but then now the supply chains are being managed for them, and therefore there's a huge surge in demand for electricity. Also, it's extremely hot in Jharkhand at the moment. I think temperatures touching around 40 degrees, 38, 40 degrees, and therefore there is a use for fans and things like that. Now, what's happening on the national grid situation? Now, one would have thought that with all the industries shut, with very little power being consumed outside of these domestic, there would be almost like 24/7 power available to these villages. Well, that's not the case. The government, the national grid continues to function the same as before. So, what is the same as before? Can we attribute some numbers to it to understand exactly what that is? So, we have installed meters in the last mile, last hut in each of these villages, and we gather the data over the last 6 months. Now, the story is not very consistent, but if you average it out, the villages' situation has improved from what it was about 2 years back. Today, almost all houses are connected, and they have almost like 10 to 12 hours of electricity on an average per 24-hour cycle. Now, this really is a very misleading figure, because there are some villages which have almost no electricity. There are some very well connected politically villages which have got almost 20 hours of electricity. So, how do you sort of rationalize this whole thing, and how do you understand this? On top of that, what Dr. Suranjeen Prasad brought out is also true. There is a problem of so reliability means that when the electricity will come, when it will go, is not something that you can predict. So there's a huge degree of randomness. So if you look, if there's a power cut today, you don't know whether it will be back in 2 hours or 20 days. The other part is about quality, and which is very, very important. And that is that against 230 volts that is to be supplied, actual supply is around, average is about 150 to 160 volts. Now that really cannot run machinery which are more than 2 kilowatts. So that's an important part of what doctor brought out, that if you have less than 2 kilowatt load only can be run, then what happens to the water supply, potable water that comes from these boring wells and so on. So we need to address this whole thing in a very, very holistic manner. So if the national grid has not been able to perform at a time when really there is no supply problem, so it means that there is something very deep-seated and deep-rooted, and that DRE is possibly one of the permanent solutions that we need to look at in the national energy mix. So we do understand, as Dr. brought out, that the problems in the health infrastructure are not purely to do with energy. There are a lot of other things like availability of skilled people, availability of qualified people. Even the people who are available, the 40% who are supposed to be there are also not there. I think if you have a permanent solution, as I said, a backup power or a primary source of power that ensures 24/7 electricity in these villages, then you would find that all these people who are now hesitating to go there would also start going there. If you look at childbirths that happen in these villages, really they don't want to, even if there's a problem, they don't want to go to the primary health center or to these small hospitals that are there, because it's not about qualified people, it's about not having energy, not having electricity. So mostly it is the midwives in the village that do the childbirths. So everything has come down to a situation today where it's extremely, extremely important. And I'm very happy, and thank you so much, Ramapati and Ashwini, for organizing this forum. We need to really look at it in a holistic manner and see where we can place DRE in this entire national energy mix. It has to have a permanent kind of a feature. And also, as Doctor brought out, we should not be doing ad hoc solutions like putting up some small solar system over there. What about maintenance? What happens for the next 20 years? Is it a permanent thing? So we need to look at a solution that's going to be permanent. There's somebody assigned to look after this. There's somebody who pays for this and ensures that there is 24/7 power in these villages. Thank you so much.
Yeah. Yeah, thanks a lot, Colonel. I think I totally agree with you that DRE has to be mainstream within the overall, power sector, because we have been witnessing for years that once we have achieved like 100% household electrification, there is always a tendency to basically denounce the role of DRE. On contrary, what I have been witnessing that DRA is playing a very critical role in terms of reviving the economy. And I strongly feel that with this reverse migration and the people coming back to their home state, there will be even a big challenge for state government like Jharkhand, Bihar, Uttar Pradesh, Odisha, Bengal, and part of Northeast as well, to provide livelihood opportunity for these migrant workers. And I strongly believe that the DRE can create a lot of jobs in the rural areas and definitely can power a lot of other critical infrastructure such as health. And we definitely look forward to basically work with you all to make DRE as a mainstream part of electricity sector to power the health and others in a big way. Pamli, coming to you, as we just basically talked about general health situation in Jharkhand, where doctor talked about 58% public health infrastructure in Jharkhand. I mean, PSC is still unelectrified. And I have a big doubt, even the rest of the 42% which already electrified is about the quality of supply. And what Colonel Vijay Bhaskar and the MLINDA Foundation is doing in those 140 villages by providing a ray of hope, by having those electricity program right there in front of their eyes, and providing an opportunity not just to create the jobs, livelihood, but also helping the critical sectors such as health. As he talked about, like four PSC have been powered through this mini grids and all, and it's really wonderful to hear from him. In your opinion, what we would like to know that like how do we create a kind of a program for a state like Jharkhand? And I know that WRI have been doing a lot of research in the state of Jharkhand. So, in your opinion, like what kind of program policy that we need to, present to the current government, which is quite positive at least to hear the views and input from the civil society. So, how do we basically take this DRE in a big way to first to mainstream it, and then at least to identify few key sectors such as a health is something where DRE becomes, one of the most important component for all the health infrastructure, say like in Jharkhand. So, in your opinion, just share your thoughts and views on creating a kind of a positive and enabling environment for DRE in Jharkhand.
Thank you, Ramapati ji, and thank you to everyone who's there online. I think I completely agree with what Dr. Suranjeen has shared and Colonel Bhaskar has shared. I would like to look at it from four perspectives. First is the data part, the evidence part. The second is the technology part. Third is the finance part. And finally is the policy part. So from my experience of working in Jharkhand and the other states, like we have also been working in Assam and Rajasthan, one thing is pretty clear that while we all understand the value of DRE, there are a lot of challenges that organizations at the ground level face. I think this is something building on from what Dr. Suranjeen has shared. There needs to be a lot of capacity building, a lot of involvement of the stakeholders, the beneficiaries, the final beneficiaries. In this case, it may be public health institutions, it may be charity, not-for-profit charity health institutions, but all these organizations, from our experience, they do face a lot of challenges. Like the doctors who run these hospitals or who are managing these hospitals are actually at lack of proper knowledge and information in terms of what to do, how to go about the whole thing. So unless we solve that one particular challenge in at least in the minds of people, the perceptions around how DRE is useful and how it can benefit, I think that's one key thing to do. And for that, I think it's kind of a cross-sectoral, cross-organizational effort which needs to be put in, which I think this kind of a platform does definitely help. So this is like basically the technology-related aspects, the challenges. The second thing is the data. So till now, there is a lot of data, and this is what we have been doing in WRI. We have been collating data on the health sector, the education sector, trying to understand at each and every primary health center level, at each and every sub-center level, what is the quality of power? As you rightly said, though a lot of these PSCs are electrified on paper, but in reality, there is a very limited time period in which they can actually operate. And this is the kind of data that we are trying to collect and put on a publicly available platform, which will actually catalyze these kind of discussions. So this platform, it's called the Energy Access Explorer, which we are developing. In fact, we were supposed to launch it just before the lockdown, but we could not do it because of the lockdown thing. This is where actually we are showing how the health indicators play out with the electricity indicators. For example, which are the areas with high maternal mortality rates, low immunization rates, and very low electrification rate. So this kind of a platform, we believe, will actually help in bringing some of these stakeholders together. Again, what we have understood is that there's a bit of a tendency to work in silos, not just Jharkhand, but across the country. The health department will feel that it is the electricity department's job, and vice versa. And we have seen a lot of programs actually being implemented, and till date being implemented in other states as well, or being discussed, where the DISCOM is not really discussing with the health department on which of the primary health centers they should pick up for electrification. Similarly, there are a lot of these large programs which are being launched by developmental by institutions, by funders, which again do not take into account the bottom of the pyramid data. And this is where I think the data plays a critical role in helping the scale up. For example, the information which Colonel Bhaskar has been providing on what they have been able to achieve, can this data actually kind of show up in a bottom-up approach to help in convincing the policymakers, or for that matter the funders, to put in more money in the right places? So that is about data. Now coming to finance, I think everything finally comes down to where is the money available, right? So, and this is definitely a big gap that we are seeing in the public sector. Definitely there are different pots of money that need to be kind of looked at. There is the MP fund, there is the kind of EADP fund, EADP kind of focus on these poorly developed districts. Then there's a DC which has some funds to spare with. But there is this kind of right now there's no streamlined approach to how to use these funds. So a kind of an integrated effort there is also required to develop a roadmap on how to develop these, how to kind of fund all what are the gaps which are there. And this will also feed into international level discussions. So for example, right now we know that World Bank is thinking about different programs at across the multiple states in India, similar to what they are doing in East Africa in terms of looking at standardization of primary health centers. But that kind of discussion can only be fruitful if the bottom of the pyramid inputs are taken. If the inputs from the district magistrate, the district collector, the joint director of health is taken. So that kind of an integrated approach has to be adopted. And all this finally, the data, the policy, the finance piece has to finally, the data, the tech and the finance piece have to feed into the policy level discussions which are happening at be it the district level, be it the state level, or be it the national level. And it has to be a to and fro movement. It cannot be that, the center, for example, MNRE has just come out with a draft guidelines where they're seeking comments for they're proposing a PPA model, a RESCO model for public institutions, and which talks about different tariff rates, etc. But has actually been the state government been consulted for that? Has the health department been consulted for that? So that is where the policy level discussions need to come together in terms of the energy department has to speak to the health department, the education department has to speak to the energy department, and particularly in the context of the health sector, where it's not just health institutions, right? It's, for example, the Anganwadis, it's the quarantine centers, which are the flood relief and disaster relief centers as well, which come under the education department. This is a typical example of how your health and energy and education department have actually got to work in tandem to solve some of these issues. I think this current situation really provides a very good opportunity to get this message out there, be it in Jharkhand at the district level or at the state level or at the national level. And we are hoping that these kind of platforms will actually help in furthering these things. And we are happy to kind of discuss further on the energy access platforms or some examples from the ground or where we have seen how DRE has helped. Mr. Ramapati. Thank you.
Yeah, thanks a lot. Thanks a lot, Pamli. I think, yeah, it's really important to look for an integrated approach, as you talked about. And access to finance has always been one of the key challenges to basically create a kind of a robust economy at the bottom of pyramid. So hopefully,